New at 6, we continue our look into major flaws in Alabama's criminal justice system. I traveled to the Limestone County Jail, where workers told me they are faced with a mental health care crisis.
And so they'll come through mail.
Registered nurse Holly Moss is the medical team administrator for the Limestone County Jail.
We had an inmate who got...
She told me she has a passion for what she does, but says there was no schooling that could have prepared her for the reality of this job.
We have several here that are, my age, or in their 20s who are disoriented. They don't know the year. They don't know where they're at half the time. They hallucinate. I've had some of them draw on windows, obscene things and scream obscene things to me, and you never know how to act, never expecting it.
Of the 272 inmates here at the Limestone County Jail, more than 55 of them suffer from some sort of serious mental health issue. None of the 55 were on the proper medication before arriving to jail.
The Limestone County Sheriff told us the situation has become even more dire because the resources available to help these people has never been more scarce.
Alabama has gone from several thousand beds back in the 70s and 80s for the mentally ill to where the last I heard is right around 1,000 beds. So I mean, it's we've got at least 5 or 6 times less beds available today than we had in 1982 when I was first elected sheriff.
The situation the Limestone County Jail is in is echoed in almost every jail in the state. It's an issue that trickles down from major budget cuts to mental health services in the state of Alabama. According to the National Alliance on Mental Illness, Alabama ranks number 2 out of the top 15 states in the nation for mental health budget cutbacks. Alabama cut funding for mental health services by 36% from 2009 to 2012. Sergeant Jackie McNatt with the Limestone County Jail says this has created a system where the same group of people get cycled through local jails because they have no place else to go.
They get trapped in this system and they can't get out and they can't get the help they need. They're on the criminal side when they need to be going for mental health help. And it's just a revolving door and they can't seem to get out of it, so they never get the help they need.
Moss told me despite the obstacles, she takes comfort knowing she is making a difference. When I asked her from her perspective what needs to change, she had this to say.
There needs to be more state-funded facilities, outpatient and inpatient facilities that people can go to that is, income-based or something to that nature to where they can afford, to get the mental health that they need.
The sheriff told us the Limestone County Jail recently signed a contract with a mental health care group that's going to help provide some assistance to these inmates. He says by no means will this solve the problem. It will, however, help direct people to the resources they need when they leave jail.